Good afternoon and welcome to the Senior Hour, which is sponsored by Providence Holy Cross Medical Center and Comfort Keepers in Home Care. I'm Barbara Cochran with my co-host,
Dr. Thomas Pilecki.
on your hometown station, 98.1 FM, AM 1220 KHTS. This is a show for, about, and by seniors, giving information to enhance one's quality of life. And our first guest this morning, speaking of quality of life, is Dr. Hajar from the City of Hope. And we're going to be talking about cancer today.
Yes.
How are you doing?
I'm doing very good. Thank you.
Good. It's nice to have you here.
Thank you.
Okay. So how did you get involved in oncology?
Right. So, that was a while back. During our rotation in internal medicine residency program, all the residents go through multiple subspecialties rotations, so we learn. And during my oncology rotation, I noticed that the relationship between the oncologist and the patients and their family is more than just one-time thing. It's more like a live thing. They keep talking to each other. They have questions. They hug each other sometimes when there's bad news or good news. So I felt that this is probably what my call is to do, and I felt that this is what I would like to do for my career. And then my mom had a breast cancer when I was still in medical school, and obviously it's devastating, as we know, to go through that as a family, and that also gave me more push to be a medical oncologist and hematologist.
I see. That's
Okay,
interesting.
so what exactly do you do as an oncologist/hematologist?
Right. So we deal with diagnosis, treatment, evaluation of patients who are diagnosed or have a potential diagnosis of cancer. So we are with them from the beginning when there is a suspicion of cancer, and we probably will do the appropriate testing, imaging, biopsies, and then put the plan of treatment with other subspecialists and write that journey with the patients and their family, supportive care, and with other specialists. So it's a long journey, and our patients are chronic patients. So we get to know them, get to know their families, even if they are far families, neighbors sometimes. It's a very cordial relationship between medical oncologists and their patients.
And you are medical director for City of Hope in this region. But what exactly does that mean? Is City of Hope a location? Are there facilities? Do you have affiliations with hospitals? I mean, what does all that mean?
So City of Hope is an NCI-designated comprehensive cancer center. Our main campus is in Duarte, California. Probably everybody knows that. We were lately ranked the best cancer care in California, number 5 in the nation. So that's where our research program, our hospital is, and or the people who are subspecialized in some type of cancers. What we have in Santa Clarita, in Mission Hills, in Thousand Oaks, in Simi Valley is what we call it the network, where we try to be there for the patients. So rather than the patient has to drive the 210 to get to Duarte, which is not fun. We do that sometimes, and it can take like an hour and a half. We are here for them. So we have medical oncologists, we have surgeons, we have radiation oncologists, we have some supportive care. So try to keep the patient locally. We have affiliations with hospitals like Providence or Henry Mayo or some other local hospitals, so we can deliver the care locally. So we are here for the patients rather than having the patient come to us.
That's awesome. So what kind of treatments are we talking about?
Right. So I've been doing this for 25 years, and major changes happened in survival, in treatment options, in how we evaluate patients. So these days we don't look for a, let's say, breast cancer patient as all of them are the same. No, every patient has her unique or his unique disease, and we do a lot of genetic testings now, precision medicine, where we look for any targets that we might have a pill that sometimes work way better than the usual chemotherapy and gives significantly less side effects profile. So I tell my patients that chemotherapy is what we used to do and we still do, is like shooting in the dark, right? You know that there's an enemy somewhere and you have your gun and you are shooting there. You don't know where. And precision medicine will tell me where the target is. And so I can concentrate my shooting on that target and be more effective. There's the role of immunotherapy these days, which basically uses our own immune system to fight the cancer rather than shooting the cancer directly with the chemotherapy. So we help the immune system to recognize, well, hey, listen, there is some abnormal tissue here, which is the cancer cells, and you'd better go and do your job. And this is evolving way of treatment. And in fact, people who developed the concept of immunotherapy won the Nobel Prize like 2 or 3 years ago, I believe. So the development of new weapons and new ways, new mechanisms of treatment is making this disease becoming more like a chronic disease, like diabetes, like hypertension. We are not as good yet, but we are getting there, where yes, we might not be able to cure diabetes, but we have some ways to treat and people live with that. And we are working on that with cancer, and there's a lot of success. Every day there's something new in our meetings and way more options for our patients.
Yeah, immunotherapy. Go ahead, Barb.
I just wanted to let you know, I've beaten cancer twice.
Oh, great.
I had it when I was 75, and I had it when I was 85. And I told my kids, if I get it when I'm 95, I'm going to beat it again.
Yes.
Yes, I had lymphoma.
Right.
And mine started as indigestion.
Mm-hmm. Yeah.
I never had indigestion, and I started having indigestion for about a week, and I thought, whoa, something's wrong. And I finally went to the doctor, and my doctor recommended that I go to UCLA, so I go to Dr. Black, Alexander
Great
Black.
man. Yep.
And I still have my port in because I used to go in there and sit, and they stick this thing in my chest here.
Right,
And I went through chemo, and but so far I've been clear of it.
Perfect. Great.
And
great.
I plan on not getting it.
Yep.
Not anymore.
Yep.
But like I said, if I do, I'll beat it again.
Yep.
You know?
Yep, I like that attitude. Yep. Yep.
But my first one was close to 4th stage.
Mm-hmm.
And it's interesting that I didn't have any knowledge of it,
Right.
any suspicion other than that indigestion.
Right.
And I knew something was wrong because I never had it.
Yep. Yep.
And sure enough, there it was.
Yep.
Lymphoma.
So this is the lesson that we tell, especially our senior people, since this is like, I believe, senior are mostly of our audience, is that don't, as we all get older, we are more prone to be sick, right? We are more prone to get heart problem. We are more prone to have cancer mainly, and so like breast cancer, colon cancer, whatever. So we need to be very careful in bringing any unusual symptoms to our physicians, so we can, diagnose that early, and when treatment is easy. And sometimes you take it out and you are fine. Sometimes you might need to do something more, so you can control it better. But rather than saying, well, I might have some flu on my stomach, I don't have, let me wait another month or so, see if I'm going to get better, and that's when things might get advanced with that. So that will be one of the advice that I will tell my patients is if you have any unusual symptoms, don't be hesitant. Just give me a
No,
call. Let me
absolutely.
do it. Let me do the appropriate testing if needed, and we will go from there.
That's
Okay,
right. Well,
so
I go to see him now once every 6 months.
Perfect. Perfect.
yeah.
And
So
it
once
used to be,
again, I know you're medical director of City of Hope, but what exactly does that mean? Is there a specific facility? How do people contact you? Like you just said, well, let me check this if I believe there's a problem. How do people, get involved with City of Hope?
Right. So we have centers. We have probably 30 plus now centers in the network, which is in Southern California, and now we are building a new hospital, which I call it copy paste of our Duarte Hospital in Orange County. Irvine is going to be up and running next year. So, but if you are in Santa Clarita, in Mission Hills, in Thousand Oaks, Simi Valley, and you have an issue that you are afraid of, maybe do I have any cancer symptoms, or I do have cancer, but I want to know what City of Hope knows, or if they have any potential of clinical trials or second opinion. So just give us a call. We are here in Santa Clarita on Valencia Boulevard in front of City Hall. We have our radiation therapy there. We have our medical oncology. We have our surgeons, GYN oncology, urologists, you name it. And everything is done locally with the local hospitals. Same thing with Mission Health. We are on the building of Providence, Holy Cross, and we have the same facility over there. So this is the idea of the network. You can Google us. You can ask your primary care physician that I would like to get the opinion of City of Hope, and can I go and do that? And we have great relationship with all of the local primary care physicians as well. But yeah,
so has anyone in your family experienced cancer?
yeah, my mom. So I was in my last year of medical school when mom became. She had breast cancer at age probably 51, I think, at that point. And that was back home in my original country in Syria. And we had to go through the biopsy, and then the news comes that it's a cancer. And I'm the doctor in the family, right? So I'm supposed to be the strong guy and fight this. We went through the surgery, and then we went through the radiation. She had chemo. And what have you, and she did well actually, and she passed not from the cancer, she passed from some other issues, but she did quite well. But that's the word cancer when it comes to a family, it's really shake everything up, and we see the sons, the people, the family who never talk to each other, now they are talking to each other because there is somebody there that who needs help. And it's amazing how that does kind of social change the social infrastructure of a family sometimes.
Yes, it does. It really does.
Yeah.
It makes a big difference.
So, real quick, you mentioned immunotherapy, which is a fascinating development. A friend of mine, like total remission with immunotherapy on a very weird type of cancer, but he had to go all the way to San Diego for it. Are you saying that it's more common now, more available now?
Yeah, we do immunotherapy in our offices, all our offices actually, we do that. And again, immunotherapy is intravenous treatment, usually every 2 or 3 or every 4, depending on the medication that we use. And it is available. It's FDA approved. We do have the capability of delivering that in our office, so people don't have to drive anywhere. The idea of it is that, again, we are telling the immune system, do your job. Go and notice that there is abnormal cells here. Go after it, fight it, kill it.
Absolutely.
And no medicine is better than what God created into us, which is our great immune system. If we just train that immune system to do the job, he does better job than chemotherapy.
Yeah, I love it. I love it. Amazing, and I'm glad to hear that it's common now or available now. Not common, but available, so you don't have to drive almost to another state in order to get it.
No, it's available in all our offices. Have the capability of doing that. We have a pharmacist who usually does a lot of education to the family about what's to expect from the treatment or what have you. And there's one every facility that we treat patients. We have a licensed pharmacist over there.
Awesome.
Oh, that's wonderful. That's wonderful. And that's so convenient, which really makes a big difference to family. It really does. To have the area available there.
Right.
And you don't have to drive 3 or 4 hours
Right.
to get a treatment.
Yeah,
Really
we were
makes a
actually the
difference.
first. We had the only and first radiation oncology suite in Santa Clarita, in city of this size. We were the only one for years, and until like recently, the hospital has its own unit now. And I believe UCLA have a unit, but I mean radiation is every day, Monday to Friday. So can you imagine driving like an hour and a half, and the treatment usually is like 15 or 20 minutes at the most. So you drive an hour and a half, get 15, 20 minutes under the camera, and then go back.
I
It's
know.
crazy. Well,
It
here you
is.
can even sometimes walk to your facility
Yes.
and get your treatment over there.
Yeah,
So
it makes-
September is Prostate Cancer Awareness Month. Can we talk about that for the next few minutes? First of all, some people are aware, that they have to pee in the middle of the night, or they can't pee as freely as they'd like to. And there's some overlap between a benign situation and a cancer situation. But it's my understanding that if men live long enough, they will get prostate cancer.
Yes, that's
So
for
it's
sure.
really just a matter of time.
Exactly.
And unfortunately, the earlier that you find this thing, the less likely that you're going to have a good outcome. Is that all on track?
Yes, you are absolutely right on the money. In fact, some researchers believe that if you live to 100% of people will get prostate cancer. I don't know if that's correct or not, but it is a disease that goes linear with the age. And there's no really symptoms that will tell you that this is for sure is a cancer. It's common symptoms that we see all with age, like waking up at night multiple times to go to the bathroom, and you feel that you are done, but you feel that there's still some urine there, but it's not having hard time getting it out. Some heaviness in the pelvic area. When the disease becomes, unfortunately, out of the prostate, that's when we can see the other symptoms of bone pain or the shortness of breath or what have you. So yeah, for screening of the prostate cancer, there's no clear guidance from task force, but usually it's a blood test called PSA, prostate specific antigen. It's again blood test. We do it, and the higher the number, the higher the chance that there may be some prostate cancer cooking there. So if the number goes, let's say, more than 10, or it doubles in 6 months or so, then that's when the primary care physician will refer to urologists who will be able to do a biopsy and more imaging and diagnose. And yes, if we diagnose prostate cancer early, then it is curable disease. You can do surgery, you can do radiation, there's hormonal therapy to this disease, and we usually don't use that early chemotherapy for this. But the earlier we find it, obviously, when it is only confined to the prostate, is the better, rather than waiting for the disease to be out of the prostate.
Well, is it wise for men to be tested at an earlier age?
If you
and
have
waiting?
if there's a family history of prostate cancer, especially early prostate cancer, family history of breast cancer, or any other
Any
mutational diseases, yes, African American patients are at higher risk for prostate cancer. This is a fact. then yes, we do recommend that we start probably around age 50. If earlier a family member there with the disease, I probably would recommend do that even earlier than 50.
Earlier. Okay.
Okay, Dr. Hajar, thank you for your time. One more time. If someone wants to get a referral to City of Hope, how do they go about that? How do they contact you?
Okay, so the easiest way is the cityofhope.com/Santa Clarita. That's our office here in Santa Clarita, or cityofhope.com, and that look for location. Or you can call us at 661-799-1999. That's our office here in Santa Clarita, and one of our receptionists will be more than happy to help guide you to where to go.
Dr. Hajar,
Wonderful. Thank you.
Medical Director of City of Hope, thank you so much for your time. You've been listening to the Senior Hour, KHTS FM 98.1, AM 1220, hometownstation.com.
Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Thomas Pilecki, on your hometown station, 98.1 FM, AM 1220, KHTS. And our guest now is Adam Laraway from Focus Physical Therapy. And I'm going to see you twice today, aren't I?
Wonderful. There we go. It'll be a pleasure. Both times.
Yes. So what are we talking about today?
Well, I thought we'd talk maybe some about shoe wear. I was listening to an interesting discussion this morning on my way to work, and I thought it was pretty interesting and pretty applicable to our senior population, because there's this move to go to, and one of the brands of shoes is called Hoka, where they have a really, really thick sole and foam to them. And they feel great. They're super cushy. They feel like slippers and that type of stuff. But as
It's Hoka?
H-O-K-A, yeah. And so I get, my older population coming in, and they're wearing them, and they love them, and they feel so great on their feet. But my concern with them, and I want to have a good discussion on this, is that with that extra foam, you're essentially putting more and more space between the ground, which is where your brain gets, like we've talked in a couple sessions recently,
Right.
about balance and proprioceptive input.
Right.
And so if you're giving less input because of these foams, you're more risk to fall, which is kind of scary, and more risk for injuries.
That makes sense.
Yeah. And, I've been a
makes
PT
sense.
now almost 25 years, and I used to make orthotics and try and, control the foot and do that type of stuff. And I've really gotten away from that in the last 15, 18 years, because, we have 26 bones in our foot, and they have to wind up. They're rigid when they hit the ground. They have to unwind to absorb shock and then wind back up to push off. And when we do give the foot too much support, we stop that ability to shock absorb, which is, I think, something Dr.
that-
Pilecki was kind of noticing what we were talking about in the break here.
That makes sense.
Yeah, and so
It
it's
does.
really, really important, that we get our feet, keep our feet strong, so that they can balance and can adjust to things as you're walking on gravel and grass and uneven surfaces and stuff like that. And I think that when you're getting to some of these shoes that are now marketed, as these great shoes for, shock absorption, but also losing some of that proprioceptive input and making your feet lazy.
Oh, that makes a lot of sense.
Yeah.
It really does.
Yeah,
Because
so I think
if you're soft and soft and soft and this thick,
Yeah.
you're really not walking,
Yeah.
are you?
Yeah. And
Well,
go ahead.
in PT, especially balance rehabilitation, it starts off with you foot on the ground, and then as you progress and you get stronger, you start putting stuff in between you and the ground in order to make it harder for you to figure it out.
Absolutely.
Unstable surfaces, a cushion, and then maybe a wobble board, and then maybe, like a power plate vibrator kind of thing. So absolutely, the further you get away from the ground, the less stable you're going to be. And that can be a problem, but I'm going to play devil's advocate here a little bit. So I think there has to be some kind of common ground.
Right.
There has to be, ideally, if you can walk barefoot in the grass, that's exactly what the foot is made for.
Yep.
Exactly what the foot is made for. And the fact that we have to walk on cement and hard floors most of our days, that is not what the foot is made for, and it's a real challenge. And I'm surprised that most people don't have constant foot pain like all the time,
absolutely.
with what we demand of our feet, jamming them into shoes that don't normally do the job properly, and then just slamming them on flat, hard surfaces all day, in and out all the time. So, what can you do about
Right, yeah.
that?
Well, I was going to say I agree with your common ground, because we really, our body's not designed to walk on concrete and asphalt, and unfortunately, in a city we live in a concrete and asphalt.
That's
That's
right.
what we hit every day, and so you do need some shock absorption. And if your feet are not doing what they're supposed to do, it makes a big difference. I also wanted to step back real quick too. A lot of my older men want to wear the Hoka shoes and that type of stuff, but a lot of my women still want to wear heels. And if you're raising a heel, you're going up even higher off of the ground, so you're getting less proprioceptive input. Plus, you're shifting your weight forward, and so that can be a recipe for falls and unsteadiness as well. So, definitely something to think about, and that component.
The highest my heel will be is this. I don't wear heels
Yeah.
anymore. Too unsteady.
Yeah, exactly.
Yeah.
Well, exactly. You're proving my
That's it.
point.
Oh,
You realized it was
absolutely.
not safe.
Absolutely. I would never wear heels again,
Yeah.
ever.
But I still get ladies, and then the worst I think is the wedges, because then you're just
Yeah.
you're raising the whole foot up.
Yeah, it is definitely a challenge. And
Absolutely.
I don't know if it's still being taught, but it was a long time since I've been in school. One of the first things you lose is the ankle stability.
Right.
And putting 3 inches of wedge between you and the ground is a pretty big challenge for the ankle.
Right.
And
That's high.
well, I see it
Whoa.
a
Yeah.
lot. It depends on how tall or lack of tallness a woman has. They may wear 3-inch heels on a regular basis.
Right. Well,
Well, I was watching a TV show, a talk show yesterday. I don't remember what it was, but the woman there had heels
Yeah.
this high.
Yeah.
And I'm thinking, how does she walk?
Yeah.
Because they're razor thin.
yeah, right.
And I'm thinking, holy cow.
Yeah. Well, and it's interesting to watch. Watch
Yeah.
ladies walk in heels, and a lot of them change their mechanics. They walk
Yeah.
totally different in heels. And if they've got quad weakness or glute weakness or anything like that, you can see, as a physical therapist, and I'm sure as a chiropractor as well, you can see those gait changes, and you're like,
And-
oh yeah, that's a
And
risk for
the
a fall.
crazy thing is, some people do better when they're up on their toes, even though you're exactly right. The proprioception has changed.
Yeah.
But the whole mechanics, basically from head to toe, or in this case, from toe to head, shifts. And for some people, that actually works better for them.
How
But in the
interesting.
overwhelming majority, I'm right on board with you
Yeah.
that the less you have between you and the ground, the better your foot is going to perform the way it was designed. That being said, there's hard surface between you and the ground pretty much anywhere we go.
Yeah.
So that in itself becomes an issue, and you need some protection. And as we get older, people tend to want more comfort in their lives.
Right.
And that's why, the shoes like Hoka are out there.
Yeah.
But again, if you know you're going to start losing your stability, and then you're going to add to that challenge by putting at least an inch of foam between you and the ground, that's even more instability. And I'm sure there are injuries from this.
Absolutely. Well, and that's how we challenge it when we're in the clinic. I mean, with you, we've been doing single leg balance stuff, but we've been doing it
Yes.
on the floor.
Yes.
Well, I have, 2-inch pieces of foam that when you go to the next level, now I'm essentially putting that shoe underneath you, and it's amazing the
thank
difference
you.
by just putting that unstable
Oh,
foam.
I can
know,
imagine.
It's
Good
more challenging,
heavens.
and I can do it
Because you're like this.
absolutely.
You're
And-
rocking from side to side.
Absolutely, and it's pretty enlightening when somebody can stand for 30 seconds, 45, whatever, on one leg, but then you put that piece of foam, and all of a sudden they're falling over after 2 or seconds,
Oh.
and so
No,
you know, it's a
this-
good challenge.
I don't want to try that. Okay. No.
Well, when you get better though, then that's where we progress, and we have different things that we challenge those balances. But you know, it's really interesting to me that, you know, the more support you give your feet, the weaker they get. They don't have to work, and you know that having a strong foot is crucial in so many aspects. You know,
Well, it's a challenge when I'm in your office.
yeah,
When you have me, if necessary, put your fingers on the
Yeah.
chest there.
yep,
But I'm standing on one leg for 30 seconds. And that seems like an hour
right,
because it you know, you start doing this and I have to put my fingers down.
yeah, yeah, to catch yourself.
Yes.
Exactly. And that's applicable too to our population who has maybe they've got diabetes, and so their proprioceptive input because of peripheral neuropathy, where they get loss of that sensation in their feet. I mean, our feet and our hands are so rich in nerve endings and telling our brain where we are in space. And you know, with diabetes, you start to lose some of that sensation, the peripheral neuropathy, or from medications that can cause that peripheral neuropathy. Well, now all of a sudden, those inputs that you were getting through your feet are muted, and so you're more likely to fall. And throw in now a 2-inch, you know, foam shoe, you know, and it just kind of adds up, and that's what puts people at risk to fall. So it's really important, and you know, I think, you know, I think you would agree that we do need to have obviously some shock absorption because of the concrete and the asphalt, but we also want to try and minimize that so that you're getting as much input as possible through your feet, so you know where you are in space.
Yeah, well, when I have to get up in the middle of the night, I sit up and put my feet down.
Yeah.
And then I've got my side table here and my another table here, and I'm able to maneuver myself if I need to go to the restroom
Yeah.
because it's right there.
Yeah.
But I have to put my feet down first. You know, I've tried rolling out and putting one foot down and then the other, and then I'm like this, you know. And I don't need to fall, not in the middle of the
No,
night.
no, absolutely not. Absolutely
Yeah,
not.
we're fortunate enough living here that many people still have grass. We haven't shifted over to an entire desertscape community. So
I have grass in the front yard and the backyard.
walking on grass is the best thing for your feet. It is
Okay,
medicine
I'm
for
gonna
your
have
feet.
to start doing that then.
Absolutely, yeah,
It is by
absolutely.
far what they were made for. They respond best to it. It is one of the best therapies you can do for
Instead of putting shoes on in the morning to go out and feed the birds, I'll just go out barefoot then.
yeah.
There you go.
As long as it's a safe environment.
Exactly.
I
Yeah.
used to recommend that to everybody, and then, you know, I hate to say it, but there could be, like, in a park setting, there could be broken glass or a hypodermic or
Yeah.
whatever. So you got to be real careful about that.
Well, I wouldn't do it any other place other than my front yard and my
Yeah.
backyard because I know what's there.
Yeah. Yeah. It was interesting. I was, again, listening to this discussion this morning, and they were talking about Nike, and Nike just came out with a study that they showed their new running shoe decreased the incidence of injury by 50%. What was really interesting is that when you actually really got into the article about the research, what they didn't really tell you was that this other number one running shoe that they had an incidence of 35% of injuries. So 1 in 3 patients or 1 in 3
Yeah.
runners was getting injured from this shoe.
Yeah.
And so
That's a lot.
Right, exactly right. So what they did though is in this new shoe, it showed that it dropped it to 17%.
Right.
So a 50% improvement, right? But it's still 1 in 7 people were getting injured from these running shoes. And you know, you think, like, especially Nike, they've been around forever. You'd think they would have all these engineers that are looking at these different,
Right.
you know, forces and mechanics and how things are going, that they would want to prevent all injuries.
Yeah.
That's crazy.
And it made me think of, like, when I was at UCLA back in 2000, the UCLA football team was doing a demo with Nike where they were trying the Nike Free, which was this shoe that was like a waffle pattern, and you literally could wring it out like a sponge. There was no support to it. And so I got on board. I wanted to try it. And for the first probably week and a half, my feet were so tired from being in those shoes all day, and it's because there was no support, and my body was used to it. Even though I had no foot problems and I was strong and doing well, my foot was weak. And so being in those shoes, they were having to work. It eventually went away, and then I noticed the difference. But it was kind of interesting to notice, like, there is some weakness, and too much support definitely makes our shoes weak.
Absolutely.
I mean, our feet
Oh,
weak,
that's
sorry.
interesting. Very interesting.
Yeah.
Whew. Well, don't we need to take a break?
Yeah. When we get back from the break, we'll have more foot talk with Adam Laraway from Focus Physical Therapy. You're listening to Senior Hour KHTS FM 98.1 AM 1220, hometownstation.com.
Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Thomas Pilecki, on your hometown station, 98.1 FM, AM 1220, KHTS. And we're speaking with Adam Laraway of Focus Physical Therapy. And we've been talking about shoes.
Yep.
Are we still going to stay on that or something else?
Sure, we can keep talking about shoes.
Shoes?
Or we can actually go a little bit different direction, but similar. You think about, we talked about, standing on hard surfaces, and most people have, either wood floors or tile or something like that, mainly in their like kitchens and that type of stuff, where you might be standing for a prolonged period as you're making a meal, getting everything ready and stuff like that. And so, a big thing now is to put these mats, in front of, your stove and your sink and that type of stuff. And so now essentially you're putting another inch of foam between you and the ground, which on one hand could be good. I mean, I think
Not for me,
not for
because
you.
I would keep getting my foot caught on that.
Well,
and then, of course, I'd have the sink right there.
right.
But I said, no,
Yeah.
get rid of it.
And they do
Out.
slope them so that there's very little lip. But it's interesting. Like when I was going to physical therapy school, I worked at Home Depot and I supervised all the cashiers at the front of the store. But they had these big rubber mats, for the cashiers, because they're standing there for 8 hours a day on concrete.
Yes.
And they had a lot
that's-
of complaints of foot pain and back pain and
Sure.
knee pain and stuff like that. And
Yeah,
then they
I
put
can
these
understand that.
shock absorbers there. And so there is that give and take that you need. Some shock absorption when you're on a surface that just doesn't give. There's for when you're walking or standing, there's what's called a ground reaction force. So every force you're putting into the floor, the force is coming back to you, and your body's got to absorb that.
Yeah, well, most of my house in the walking area that I walk is not carpet.
Yeah,
It's wood flooring.
yeah,
And and I walk around barefooted all the time
Yeah.
inside the house.
yep.
It's too much hassle for me to get out of bed and reach over and pull on a slipper or a sock or whatever, and I think, forget it.
Right. Yep. Absolutely.
I'll put something on if I have to go outside or whatever, but which I usually do if I go out and when I go out and get the newspapers.
Yeah.
But I'll have to go barefooted on the grass now.
Yeah.
Go out and feed my birdies.
There you go, for sure. It's interesting too. I think back, like, I don't know if you remember this, but they used to make these shoes. They were by a company called MDT, and they were these rocker shoes.
Yeah.
And they were really designed for patients that had had a stroke, so they would actually help you with that kind of rolling activity.
Oh,
But they
interesting.
became all the rage, 15 years ago, maybe 12 years ago, something like that.
Yeah.
And I was getting questions about them all the time from patients, like,
I
are
had
these
'em.
good shoes? Are they? Did you really?
Yeah, I had them.
I was very against it, and I got a little bit of backlash about it. But I just thought it's doing the rocking motion for you. Can you make yourself any more lazy? And and then they started having all kinds of issues. So now you don't see them hardly at all.
I can't imagine it would be good for you.
Yeah, it wasn't. I mean, and that was really thick foam.
Yeah.
What was your rationale for wanting to have those?
Supposedly, it was like a rocker. In rehab, we occasionally use rockers
Yeah.
for different conditions. And again, this made Hokas look like flats. Like this was twice as thick as a Hoka easily.
And really
so
smushy
yeah,
foam.
so you were rolling out every footstep, and the old thought was heel strike, roll off the side, and then big toe off.
Yep.
And we've thrown all of that out the window with all the new ideas about, well, just fall forward, instead continually fall forward, and it's a lot better for the mechanics of running, for basically. All of the ultra marathoners have adopted a completely different mechanic of how their foot interacts with the ground.
Yep.
So I believe that was probably the nail in the coffin
10,000.
for MBT,
Yeah.
as far as getting rid of the old Ciba-Geigy instructions on, slam your heel into the ground and then try to roll off of it. So I think that was a bad solution to the problem, and we've just decided, well, we're going to do it different now.
Thank
If that
goodness.
makes, yeah, if that makes any sense. So Adam, real quick, give us your contact information.
We are located at 25050 Peachland Avenue, Suite 205 in Newhall, and we can be reached at 661-255-4205, and our website is www.focusptscv.com.
Thank you for coming in today and talking about feet. You've been listening to the Senior Hour, KHTS, FM 98.1, AM 1220, hometownstation.com. We're brought to you by Providence Holy Cross and Comfort Keepers. Now go out and enhance your quality of life.